I'm joined in the studio now by Monica Richards, founder of the Benzo Research Project. Monica, that's quite a startling watch. You think this is such a big problem. You actually spoke at the UN about it this week. Talk to me about the scale of the problem, particularly amongst young people, why they're using benzos.
Well, firstly, I wanted to say thank you very much for having me here to discuss this issue. As you guys have just seen, this is an incredibly important issue to be discussing. We at the Benzo Research Project are concerned about the changes that we're seeing. We're seeing young people using benzos. We have been seeing a rise in the number of people using it, particularly non-medically or recreationally, so outside of a direct prescription. And yeah, we're incredibly concerned about what we're seeing. So we collected testimonies to try and understand the lived experiences of young people who are using benzos and understand their motivations for use, understanding their scope of use, when they first started using. So we've gotten quite a broad picture.
And what were they telling you? Why are they using them?
So there were several key reasons that were brought up. First of all was for mental health purposes and to cope with conditions such as anxiety, insomnia, PTSD. And so I think it's important for us to view this with compassion. There's also a broad range of uses. For example, some people take them to come down off of stimulants, as well as to help with psychedelic trips, for example, to help reduce long-term psychological damage caused by a bad trip.
So is the feeling that much of this amongst young people is recreational?
Yeah, I mean, I think it depends on what you define as recreational, because some people define that as all use outside of a direct prescription. So some people use it recreationally to heighten the effects of other drugs. And we saw quite a lot of that being used, and so that's called polydrug use. When people use benzos alongside another substance, either to enhance the effects of that whilst they're on the substance, or to help come off.
Young people are getting themselves into a predicament using these drugs, and obviously your research is showing what's happening to them, why they're doing it. What do they need? Because essentially what's happening is drug abuse, and when you say drug abuse, there's a stigma around that and a reluctance to talk. And young people, whatever you think, are going to use drugs. They just are. But they're frightened to talk about it if they have a problem with it or if they want to get hold of them safely. So what do we do?
I think that's a very good question, and one that should be asked at all levels, whether that's at a local, regional, national and international level.
At the UN, yeah.
Yeah. And I think the matter of stigma is one that's incredibly important to speak about. I think it's one that goes... It's talked about a lot in the drug policy community, but not necessarily outside of that. So we've
got an old-fashioned approach to drug taking, basically.
Potentially, I'd say. Because, for example, we've seen stigma present at all educational levels. We've seen stigma present in GP practices as well, asking young people to taper, so come off the substance, using the illicit market.
Right, okay.
And saying that the only way that they would prescribe is if they pledged to come off them. So stigma is incredibly important.
Monica, just finally, if someone is watching tonight and they're thinking, that's me you're talking about, where can they go for help? Because that's really important, right?
Yeah, absolutely. So, for example, there is a drug testing centre called Wedinos, and in Bristol there's the creation of The Loop, and they're doing great things, and it's really, really encouraging to see. There's also, for example, I'd urge people to reach out to your local drug support centre, mental health support centre. There's also online communities, some that are anonymised, some that are not, including Reddit, for example, where people can seek that peer-to-peer support without necessarily...
Which is so much easier, isn't it? Yeah, without being judged. OK, Monica, really interesting to talk to you. Thank you so much off the back of our report there, which was really startling, a really important discussion to be had. Thank you. It's going to continue, I know that much. Thank you.